On the line with us now is Jon Beougher, and he's a physical therapist over there from KORT Recovery and Reconditioning Program. Jon, welcome into the Deener Show.
Yeah, thanks for having me.
Yeah, so so tell me, a lot of people are, they're getting into back into working out. They're emerging from this isolation. How did this program get started, and how could it help somebody in the Recovery and Reconditioning Program?
Yeah, so what we did with the Recovery and Reconditioning Program is we looked at specifically COVID-19. And literally everybody's been affected by COVID-19 in one way or another. And one of the things that we're called to do as physical therapists is endeavor to address the health needs of society. So I actually had the privilege of working with a patient starting about 2 months ago who actually had been diagnosed with COVID-19. And when we look at what goes on with COVID-19, there's a lot that goes on when people actually get the coronavirus, that it affects multiple parts of their body systems. And so oftentimes people think about physical therapists just being there to recover from injury or to help with pain, and we definitely do those things, but we're also really well situated to be able to help people recover and get back to function after illness. And what we specifically did with COVID-19 is looked around and saw that people were scared. People were scared to get the COVID-19. People were scared after they got it, and then after they got it and they're trying to recover, they don't really know what to do. And we stepped in and said, you know what, we can help. And so we put a lot of effort and time into developing this program specifically designed to help people recover and get back to their life after they've had COVID-19.
Yeah, there are a lot of folks who have, gotten the virus. The virus has left their system, but they are left with a lot of different issues that probably a lot of people don't realize, whether it's getting their wind or just being able to walk, and if they've been in a hospital for a prolonged period of time, kind of get their muscles back. What are you all seeing as it relates to those particular patients?
Well, yeah, you just kind of nailed the top three. A lot of times we think about coronavirus as a respiratory disease, and that's definitely part of it. A lot of these patients, the primary impact is in their lungs, and the primary manifestation of that is difficulty breathing or shortness of breath with activity. But for these patients that were hospitalized, they lose their strength so quickly, 3 to 5% per day of their strength they can lose while they're in the hospital. And so when they come back out of the hospital, they can be substantially weaker. So it's not just a respiratory issue at that point. It's trying to figure out how do they get their strength back, how do they get the movement back. And even for the patients that haven't been hospitalized, what we know about COVID-19 now is it affects more than just the lungs. There's many body systems that can be affected. So for anybody that's had it that feels kind of recovered and isn't really quite sure what to do, there's a lot we can do to help to assess those body systems and help come up with a really safe treatment plan for people so that they can make sure to get back to their goals and get back to their life.
And what are you seeing from people who, tested positive from COVID-19? Maybe they had mild symptoms or maybe they were asymptomatic, but as they return to exercise, how would the program help somebody like that, maybe that wasn't, hospitalized, but had the disease? And what are you guys seeing when they start the Recovery and Reconditioning Program over there at KORT?
Yeah, it's a great question. So what we're seeing typically with those patients is that deconditioning. So that's why we call this the Recovery and Reconditioning Program. So most people, when they recover from an illness like this, they know in theory, I probably should be exercising, but I'm not really sure what to do. Or specifically with COVID-19, I'm not sure what's safe to do. So for example, right now, we have got college football players, NFL players reporting to camp, and they're going to start working out really hard, and they're going to get really short of breath when they're doing their conditioning tests and they're working out. And for them, that's safe to do. For our patients that are recovering from COVID-19, part of what they need to understand is where is the safety guidelines going to cut off their exercise. So what we're doing when people come in is we're assessing all the vital signs specifically, oxygen, heart rate, blood pressure. We're also helping them understand what their difficulty level of breathing means and what's going to be a safe range for them to work out in. So as we go through a lot of these standardized tests with people, we're able to make sure that the exercise they're doing is, first off, safe, but second, that it's effective. If you do exercise that's too easy, you're not going to recover as fast as you like. And if you do exercise that's too hard, you may compromise the safety. So that's what this program is designed to do, to use the combination of standardized testing with all of these vital signs being monitored, where we're going to be able to really pick up what your strength deficits are, what your aerobic deficits are, how you're breathing, how your vital signs are responding to exercise, and come up with an individualized exercise plan for each patient.
And I'm just curious, are you guys seeing, like people who were asymptomatic and are young and that are getting back into athletics that are just like they went on a run and then they're just like, man, I got to call, KORT over there and figure out what's going on. I guess maybe I did have the coronavirus and maybe they are struggling to get back to that. Are you seeing young people, with that effect now? I'm just my own curiosity.
Yeah, definitely. We've actually had some case studies within our nationwide company where we've looked at that exact thing, where younger, healthy people have had this issue come up, and it really has impacted them quite a bit. And so for those people that are just like, I just don't feel right as I'm doing these things, often not knowing what to do is one of the most difficult parts. So they know they want to get back to feeling the way they felt before they got coronavirus or before all of this came about, and they're not really sure of the safety on how to do that. They're not really sure exactly what to do. So yes, even on those younger patients or those patients who at the time they had it felt like they were asymptomatic and felt like they're recovered, this program is going to have a lot of benefit just to know for sure, hey, let me get my body systems checked out. Let me make sure my vital signs are good. Let me make sure I know exactly how to progress my strengthening and aerobic conditioning program. Whether you're having trouble walking from the bed to the kitchen or going for a run, this program is going to be able to help people in that entire spectrum.
What does a typical evaluation and treatment plan look like on KORT's recovery and reconditioning program?
Yeah, so from the safety perspective, everybody's going to be getting their vital signs checked before we start exercise, during exercise, so that heart rate, oxygen, blood pressure, how difficulty the breathing is doing. So as we go through the individualized assessment for people, we're going to be looking at each person, how they're breathing. We've got some aerobic endurance tests we're going to do to help us determine how hard to make the exercises. We have some strength tests we're going to do to determine how well people are moving, make sure we prescribe the appropriate difficulty of strength exercise. So as people come in, when they leave, they should know exactly how to be working on their breathing, exactly how hard to be exercising. And what we're going to do as we do these standardized tests is make sure we match up the actual exercises to each patient's individual goals. So we're really going to listen to people. We're going to hear what they have to say, what their concerns are, and make sure that our program, although it's very safe and very standardized, also meets each person's individual goals.
And, everybody's kind of worried about, whether or not they could go into public or sit into a waiting area. Do patients have to come into the clinic to receive this treatment?
They don't. We've been talking about having 3 convenient treatment options for a little bit now. And so if you go to KORT.com, you can live chat with us during the day, or you can get on and request an appointment. And we've actually got 3 different ways that people can receive this program. We're doing this via telerehab. We've got this telerehab platform where we can connect via smartphone, tablet, or laptop. And we have some things that we can be doing with people through this recovery and reconditioning program via telerehab. We also have the ability to do the in-home rehab with people for this and do that outreach, outpatient therapy at home program. And we also still have the ability for people to be coming into the clinics as well. So if you get on KORT.com and live chat or request an appointment, if any one of those 3 sounds like it would be ideal for you, then go ahead and request an appointment on there, and we'll get in touch with you and make sure that we can help set up to make sure that you feel safe with where you're going to be getting your treatment, and we'll make sure that you're safe as we deliver the treatment.
Fantastic. Yeah, and Jon Beougher here with us with KORT Physical Therapy. Appreciate, you guys being in our community. And I know that this is going to change how you all treat it from today to 3 months from now may actually change as we learn and adapt. And just thank you guys and everybody over there that's just been working so hard to keep everybody healthy.
Yeah, well, thanks for your time letting us share our program with your listeners.